Best supplements for hair, supplements for increasing the volume, supplements to prevent baldness. Do you want to treat your hair loss without minoxidil? Such questions, such advertisements, such videos are plenty on social media. What is the truth? Do supplements have a role? If they have a role, in which type of hair loss? Do they prevent baldness? How long they have to be taken? Is there any risk in taking them? To answer these questions, I am here, Dr. Venkataram, Mysore, dermatologist, hair transplant surgeon, Venkat Center for Aesthetic Health, Banashankari, Vijayanagar, Cunningham Road, Bangalore. Hair is a peculiar organ. It's an organ. It has a living portion and a dead portion. As you can see in this diagram, the portion that is seen as a black shaft coming out of the skin is the dead portion. What is inside, up to about 4 millimeters inside the skin, is the living portion. So the hair is produced from the living portion. What you see is the dead portion. Now the dead portion is almost entirely composed of protein called keratin. Now the living portion has got multiple layers and has got cells which multiply at a very rapid rate. Hair cells are the ones which multiply at a very high rate, just like cells from the bone marrow. There are different types of cells. They all multiply differently and together they produce the shaft which comes out of the skin. And during this rapid multiplication, hair needs plenty of nutrients in order to produce a hair which is looking good. So hair needs food supplements. That is a fact. There is no doubt about that. What are the supplements which are needed? It needs most of all proteins because the entire shaft is made of protein. You need 1 gram per kg weight of protein, which is about 60 to 70 grams of protein. And to do this, you have to take adequate food. If you are a non-vegetarian, every type of non-vegetarian food from meat to chicken to fish contains good quality proteins. If you are a vegetarian, it's a little tougher job. Milk contains protein. If you eat egg, that also contains good protein. Otherwise, it is pulses, sprouts, tofu, soya, broccoli, makhana, etc. And so vegetarians have to make a special effort to eat these things. Then it needs vitamins, B12, B6, folic acid. It also needs biotin, famous or infamous, whichever way you look at it. Biotin has got a great reputation as a supplement for hair, which is totally undeserved. It has a small role in the cells. It is necessary for an enzyme called carboxylase. But beyond that, it does not have a special role. But for some reason, it has achieved popularity, both amongst doctors and amongst patients, that it produces good amount of hair. Iron is very important for hair. Iron deficiency is one of the commonest causes of hair loss. So this definitely needs to be supplemented unless the patient is able to take non-vegetarian food. Egg contains iron, milk contains iron, leafy vegetables, beetroot, they all contain plenty of iron. Then you have vitamin D, which is very important for hair. Vitamin D deficiency may be associated with hair loss. Vitamin D is largely synthesized from sunlight, which is available in plenty. But ironically, almost everybody has low serum vitamin D in India. And for that, there are vitamin D tablets which you can take once a week for 5 weeks. Vitamin A is necessary for hair, for keratinization, that is production of that protein. But too much of vitamin A paradoxically can cause hair loss. So you should avoid eating too much of vitamin A. Vitamin E again has a great reputation on social media, but it's an antioxidant but has no definite role in preventing hair loss. Other things like zinc, magnesium, copper, these are all necessary in small quantities. Now, when a patient comes to us with hair loss, if he has a temporary hair loss called telogenous fluid, which is a change in hair cycle, they usually need some supplements, iron, vitamin D and B vitamins, along with protein. This is given for about 3-4 months, by which time it improves. If there is a specific iron deficiency, it needs to be given till hemoglobin becomes normal, and then for 2-3 months beyond that. But in pattern hair loss, the role of nutrition supplements is a bit debatable. If you have normal supply of vitamins, then the nutritional supplements may not do much for a hair loss. But in India, what happens is, there is usually some kind of deficiency. Young people, they go outside their homes, stay in PG, stay in hostel, or they stay by themselves. Their food habits change when they come from one place to another place. They may not get proper food. And these days, young people's work is very heavy. They work for 10 hours or 12 hours. Often they are on night duty continuously. So their entire food habits goes for a toss, with the result that they are not able to take properly what is needed. Or they may end taking up junk food, whatever is available for a quick bite. Hence, these people need supplements. So please understand that. If otherwise a good deficiency, good diet is assured, there should not be much of a need for nutritional supplements. But as it so happens practically, people do suffer from deficiencies, and hence they need supplements. But this is usually for a period of few months. And this is a adjunct treatment, additional treatment. This is not the sole treatment. You still need to take finasteride or dutasteride, as the case may be, minoxidil as and when it is needed, PRP, etc. Along with that, you need the supplements. But then a patient always needs a wholesome approach. He needs to take care of all the requirements, from nutrition to emotional stress to avoiding smoking, avoiding stress, exercise, drugs, biological regenerative treatments like PRP, and transplantation as it is needed. So a hair patient should take supplements, particularly in the early part of the cycle. So this is the second fact. But please do not think that you will treat your baldness only by supplementation. It is an additional requirement. There is something called a cyclical therapy which many companies have floated, wherein you are taking supplements at low doses in a periodic way. Now, you don't need too much of these supplements, that is correct. You don't need them daily, that is also correct. So, by a clever cycling of these things, it makes it convenient for a patient. Instead of taking tablets daily, you take one tablet once in 3 days, another tablet once in 2 days. So, that is what is called cyclical therapy. There is a logic in the sense that you need them periodically, so you give it. Beyond that, this is the same nutritional supplementation as what is done everywhere. So, the final summary is, please be careful about this supplementation. There is often a tendency to take too much protein, particularly whey protein. 100 grams of protein, 200 grams of protein, 20 eggs, 15 eggs. That is harmful. It raises your uric acid. And then muscle building activity is an androgen activity, which may actually hasten the hair loss. So too much of protein is also not necessary. Likewise, too much of vitamin A is bad, too much of vitamin D is also bad. Balanced diet, supplementation in a scientific way is what is needed. That will definitely aid in growth of hair in cases of temporary hair loss and in cases of pattern hair loss where there is some deficiency. But otherwise, do not be misguided by advertisement that you see that you take this capsule and the hair will grow in a bald person. That does not happen. Or some advertisements say this is collagen, this is keratin, take it, seaweed protein. So many advertisements come. Please note, any protein which is taken by mouth is digested in the stomach and intestine by proteolytic enzymes. They are broken down to amino acids which are absorbed and then they reach the liver, where they are synthesized into the protein that the body wants. So, they may become collagen for the skin, keratin for skin or hair, other proteins for the muscle or the bone. Body will synthesize it. It is not that you take keratin by mouth and that directly goes into hair and sits it. It doesn't happen like that. So, don't be misguided. They are expensive and it is unnecessary. So, protein is what is needed. particularly containing essential fatty amino acids, which are not synthesized in the body. So I do hope that this gives you adequate information about protein supplements. Please take them logically, rationally, and as per proper advice. Do not think that they are the only treatment. Please note that they are supplements. They are only additional. They are not the primary treatment. And so take them as per scientific advice. Contact us for further advice. I do hope that you have liked this video. Visit our website venkatcenter.com. We have opened a new hospital in Banshankari. Please visit us. If you have liked the video, share it with others. Thank you very much. Namaste.